Okay, let's unpack this. Imagine a virus, one that's notorious in horses, but it silently jumps species and causes just absolute havoc in animals you might never expect. We're talking about Equine Herpesvirus-1, or EHV-1, and today we're taking a deep dive into its hidden dangers, specifically for camelids and cervids. So our mission for you, the listener, is really to reveal the specific, often quite devastating ways EHV-1 shows up in llamas, alpacas, and deer, and why it's so severe, and what we absolutely need to know about, well, preventing its spread, especially in places where different species mix. Get ready for some serious aha moments, I think. Stuff that might fundamentally change how you view animal health.
Yeah, what's truly fascinating here is how a virus that's so adapted to one species, horses, can have such a different outcome in others, often a much more catastrophic. EHV-1 is an alpha herpes virus. That's a type of, fast replicating virus known for setting up shop for life, latent infections, and it's everywhere in horse populations. Most horses see it by the time they're two. But its ability to establish those hidden lifelong infections and then cross-species barriers, that poses a significant and I think often underestimated threat. We'll explore not just what happens, but maybe get into the why these differences are so profound.
Right, so in horses, we sort of know the drill.
Hmm.
EHV-1 can cause a range of issues, things like relatively simple respiratory cold, what vets call rhinopneumonitis,
That's right.
to more serious outcomes like abortions in pregnant mares or that severe neurological syndrome, EHM, equine herpes virus, myelinoid encephalopathy. But here's where it gets really interesting for our deep dive. When this virus decides to, visit other animal families, the story changes dramatically. What is it about EHV-1 that makes it such a different and often more dangerous beast in these other animals?
Well, the core of its pathogenesis, that's how it causes disease, is really critical here. Unlike a related virus, EHV-4, which usually just stays in the respiratory tract, EHV-1 has this unique ability. It can infect lymphocytes, which are a type of white blood cell, so it becomes cell-associated. It can travel throughout the body and the bloodstream, basically hidden, shielded from the host's antibodies. This establishment of what we call cell-associated viremia, that's the pivotal event for systemic disease. It allows it to reach all sorts of organs.
So it's like a truly ingenious strategy, if a bit terrifying, hiding inside the body's own defenses. What makes that particular Trojan horse mechanism so effective in EHV-1? Does it, actively manipulate the immune cells or just ride along?
It's mostly a passive ride, but incredibly effective because it lets the virus dodge the circulating antibodies that would normally zap free virus particles. Once it has that stealth transport, the unifying mechanism across all susceptible species, horses, camelids, cervids, is something called endotheliotropic vasculopathy.
Okay, that's a mouthful. Endotheliotropic vasculopathy.
It is. Essentially, the virus attacks the endothelial cells. Those are the cells lining the small blood vessels. This triggers a potent inflammatory reaction, which leads to blood clot formation, thrombosis.
Ah, okay. Clots.
Exactly. And consequently, that reduces blood flow, which is ischemia, and that can cause tissue death, infarction in the surrounding areas. So it's usually not a direct attack on the neurons themselves, but rather a devastating cutoff of the blood supply to critical tissues, like the brain, spinal cord, or the delicate parts of the eye.
So the really profound insight here is that EHV-1 doesn't just make an animal sick. It essentially starves vital organs of blood, leading to this awful, often fatal tissue damage. That's a chilling mechanism. But I'm wondering, does the type of EHV-1, like different strains, also play a part in how severe this strangling effect becomes, or is it always the same underlying issue?
Oh, it absolutely plays a role. There's a tiny genetic variation, just a single nucleotide polymorphism, a tiny change in the virus's DNA polymerase gene that differentiates two main genotypes. There's the D752 strain, often called neuropathogenic, and the N752 strain, often called non-neuropathogenic.
Right, I've heard those terms.
Yeah, and the D752 strain is strongly associated with a higher level and longer duration of that critical cell-associated viremia, which, increases the probability of the virus reaching the central nervous system. However, and this is a really crucial point, this is a risk factor, not destiny. We've seen quite clearly that even the N752 strain, the quote-unquote non-neuropathogenic one, can cause severe and fatal neurological disease, up to maybe 25% of EHM cases.
Wow, okay.
Yeah, so this really underscores that host factors, age, immune status, stress play a pivotal role too. It means any EHV-1 strain in a susceptible population is a potential threat.
So the big insight is don't get complacent. Even the supposedly milder strain can be deadly, which means every EHV-1 infection in a susceptible animal is a serious alarm bell. Needs attention. not just specific strains.
Hmm.
Makes you wonder if maybe some of the early focus on just identifying the bad strains might have been a bit of a, well, a red herring, or at least an oversimplification.
Okay, now let's turn our attention to the charming camelids, llamas and alpacas. For them, EHV-1 isn't just a concern. It sounds like a really serious threat. What does it actually look like when they get infected?
In camelids, yeah, particularly llamas and alpacas, EHV-1 causes very severe neurological disease and also quite distinct ocular disease. The neurological signs are, well, they're dramatic and often progress very rapidly. You might see severe incoordination, ataxia, or weakness, especially in the hind limbs. That can lead to recumbency, where they just can't stand up, and eventually paralysis.
Awful. It is. Other signs include things like head tilt, nystagmus, those involuntary eye movement circling, profound changes in their mental state like depression or stupor, muscle tremors, head pressing, apparent blindness, and dysphagia, difficulty swallowing. Experimental studies have shown just how devastating this can be. In one study, 2 out of 3 infected llamas developed severe neurosigns within days. One died acutely, the other became so ill it had to be euthanized.
That sounds absolutely heartbreaking, such a rapid decline into severe illness. And you mentioned ocular disease. Is that related to the same blood vessel damage, the vasculopathy?
Precisely. And this is truly fascinating history here. EHV-1 associated ocular disease, specifically chorioretinopathy, that means damage to the choroid and retina at the back of the eye. It was actually first described in llamas and alpacas back in the late 1980s.
Really? Before it was widely recognized in horses?
Yeah, exactly. Before it was a well-known thing in horses, it presents as these permanent, multifocal, depigmented lesions in the ocular fundus. People describe it as having a kind of shotgun appearance.
Shotgun appearance, okay.
Yeah, the damage occurs in the choroid, which is behind the retina, due to that same vasculopathy cutting off blood supply. And interestingly, the lesions appear with a delayed onset, usually 3 weeks to maybe 3 months after the initial infection. It takes time for that damaged tissue to depigment and become visible.
So it's like a silent, delayed photograph of a past infection.
Yeah.
Wow. It really makes you wonder, doesn't it? How many other diseases we mainly link to one species actually have these deep, untold histories in others? A real detective story for vets. Given this devastating impact on camelids, how do we actually catch this virus in time? And maybe more importantly, what are our best strategies for managing or ideally preventing it?
Well, for diagnosis, it's usually a combination of things. Clinical signs, a thorough neurological exam, and an ophthalmic exam. Then, quantitative real-time PCR or qPCR, that's the preferred method for detecting the actual viral DNA. You'd test samples like nasal swabs, whole blood, cerebrospinal fluid, maybe ocular fluids. Serology looking for antibodies can show if an animal's been exposed in the past. But it's not always reliable for diagnosing an acute case in camelids. The assays aren't really fully validated for them, so a positive antibody test just tells you about past exposure, not necessarily current disease.
Right, not super helpful in an emergency.
Exactly. Treatment is primarily supportive care, focusing on anti-inflammatory meds, IV fluids, intensive nursing for animals that are down. But the real emphasis, crucially, has to be on prevention. Strict biosecurity, preventing contact with equines, immediate isolation of any sick animals, rigorous hygiene in mixed species places, and importantly, there are no specific EHV-1 vaccines available for camelids, so management practices are absolutely key.
Okay, let's move on to another group then, cervids like deer and elk. Here, the direct evidence of EHV-1 might be a little scarcer, but the inferred risk and the consequences sound just as severe, maybe even more so. What's the situation for these animals? And how do we even begin to assess the threat if there aren't loads of direct case reports?
Yeah, the host range of EHV-1 does seem to be expanding, and it definitely can affect deer, especially where there's close contact with infected equines. The European Food Safety Authority, EFSA, they officially list Cervidae as susceptible. And while, like you said, there aren't many published specific case reports for our native North American cervids, white-tailed deer, elk, we do have strong proxy models from other related animals, other artiodactyls.
Artiodactyls, right, even-toed hoofed animals.
Exactly. Deer, cattle, giraffes, that group. We have documented cases in captive settings, like in Thompson's gazelles and reticulated giraffes, and they presented with fatal neurological disease, specifically meningoencephalitis. That's inflammation of both the brain and its surrounding membranes.
Wow, fatal.
Yes. And these cases consistently link back to equid reservoirs. Often, again, zebras seem to be the source of infection.
So it's like a vivid warning sign from related species that deer are also at incredibly high risk, even if we haven't seen, say, widespread outbreaks documented yet. But if we do suspect the EHV-1 in a deer or an elk, How do we differentiate it from other similar viruses? I've heard there's a particular diagnostic challenge here.
That's a very insightful question. Yes, a critical diagnostic challenge exists with another virus called Equine Herpesvirus-1, EHV-9. EHV-9 is genetically very, very similar to EHV-1. They share something like 86% to 95% nucleotide identity.
That's close.
Very close. But EHV-9 seems to have an even broader host range and potentially a more pronounced neurotropism, meaning a greater affinity for the nervous system. And the profound insight here diagnostically is that standard serology, the antibody tests, they completely cross-react between EHV-1 and EHV-9. So those tests are unreliable for telling them apart. You absolutely need molecular techniques, qPCR or gene sequencing, for a definitive diagnosis. Without them, you just can't be sure which one you're dealing with.
Okay, that's a significant hurdle then, and a crucial distinction to make, I imagine. What about North American cervids specifically? If the published data is scarce, how confident can we be about the risk to our native deer and elk populations? Is it just theoretical?
Well, while we lack those specific published case reports for native North American cervids, the inferred risk is, I'd say, undeniably high. The biological precedent from other susceptible artiodactyls is strong. Plus, you have many cervid species managed in farmed operations or in zoological parks where contact with horses or zebras is entirely possible, even common.
Right, mixed species environments again.
Exactly. So considering how common latent EHV-1 is in equids and the catastrophic outcomes we see in other spillover hosts, the potential for severe neurological disease in cervids under those conditions is, well, it's undeniable. And we know from other diseases like epizootic hemorrhagic disease, EHD, which affects white-tailed deer, that the cervid vascular system is susceptible to viruses that cause widespread blood vessel damage, which is, of course, a key feature of EHV-1 pathogenesis. Unfortunately, the prognosis for cervids showing severe EHV-1 neurological signs is often poor. Many require euthanasia.
It's really striking that this same virus, causing the same type of blood vessel damage that vasculopathy, leads to such wildly different outcomes across species. What's the fundamental reason? Why do horses seem to have this broader disease spectrum, while for camelids and cervids it seems like it's often a rapid, fatal hit straight to the brain?
Yeah, considering the wider implications, this really highlights the impact of host adaptation, coevolution. In equids, the natural host, we see that broad spectrum: respiratory, abortion, EHM, ocular disease. But EHM isn't, an inevitable outcome of every infection. The horse immune system has co-evolved with the virus over millennia. It has some mechanisms to control that viremia, at least to some extent.
So horses have built up some defenses over time, a kind of uneasy truce with the virus, maybe.
Precisely. That's a good way to put it. Now, if we look at camelids, the disease picture is predominantly severe neurological and ocular disease, that mild respiratory phase that often precedes systemic disease in horses. It doesn't seem prominent in the documented camelid cases, and abortion hasn't been reported. The disease appears to progress very rapidly from that initial infection to severe neurological compromise. And then for cervids and other artiodactyls, it seems even more focused, almost exclusively presenting as fatal neurological disease, that meningoencephalitis. This suggests maybe a low frequency of actual infection spillover, but an extremely high consequence when it does happen. The central nervous system seems to be the primary and catastrophic target. These species might very well be what we call dead-end hosts. The virus triggers such a rapid fatal disease course it can't effectively transmit further from them.
So for these non-equid species, it's not just a bad cold that might get worse. It's often straight to brain damage, and quickly. But why is it so much more aggressive? Is it just the lack of that co-evolved immune control? Or is there something else happening at, like, a cellular level, maybe?
That's a crucial point that emerges here, and an area of ongoing research. It's thought that in these non-adapted hosts, yes, the absence of those co-evolved immune control mechanisms likely leads to a more rapid and poorly controlled viremia after the initial infection. This lack of an adapted immune response could let a higher viral load reach the CNS and the eye vasculature, triggering a much more severe, widespread vasculitis.
Okay, so the floodgates open wider, essentially.
Well, kind of, but there's also some interesting pathology seen in non-equids, like gazelles and giraffes. There's evidence of neuronal intranuclear inclusion bodies.
Inside the nerve cells.
Yes, exactly. Very specific damage inside the neurons themselves. This suggests the virus isn't just cutting off the blood supply, but it might be directly attacking and replicating within the neurons, too, which is somewhat distinct from the primary ischemic model we usually talk about for EHM in horses, so potentially a direct cellular assault on the brain in addition to the blood supply cutoff.
Wow. Okay, so given this complex, often devastating picture. How do we actually identify and, more importantly, prevent EHV-1 from devastating these susceptible populations?
Yeah.
Especially in places like zoos or mixed species farms where different animals live pretty close together. With this kind of invisible threat potentially coming from our equine friends, it sounds like we can't just cross our fingers and hope. We need a full-on biosecurity fortress, right?
You're absolutely right. Biosecurity is paramount. There's no other way. For diagnostics, as we touched on, qPCR, quantitative real-time PCR, is the preferred method for detecting active infection because it's highly sensitive. You'd sample whole blood, especially the buffy coat layer, CSF, nasal swabs. Post-mortem, you'd want histopathology combined with qPCR and immunohistochemistry on the CNS tissues. That's essential. The diagnostic challenges remain with serology in non-equids, the validation issues, that cross-reactivity with EHV-9 we mentioned. So again, a positive antibody test usually just tells you about past exposure, not necessarily acute disease right now.
Right. So testing for antibodies just isn't enough to say an animal is currently sick with EHV-1. That means we have to be incredibly precise with our diagnostics. But if these equid carriers often show no signs, and we can't really vaccinate the non-equids effectively, aren't we essentially fighting an invisible enemy here? How can we ever truly secure these mixed species environments against such a pervasive hidden threat?
That is the central challenge, and it's a truly critical insight for anyone managing these animals. The biggest threat often comes from outwardly healthy equids. The asymptomatic equid reservoir is the silent, ongoing source of risk. Most horses, donkeys, mules, and especially zebras are lifelong latent carriers. They carry the virus hidden away. Stressful events transport, mixing, other illnesses can trigger viral reactivation and shedding. And often, the equid shedding the virus shows absolute no clinical signs itself.
The silent spreader.
Exactly. Zebras in particular have been repeatedly implicated as the source of fatal EHV-1 outbreaks in species like camelids and giraffes in zoo settings.
So it's the silent carrier that's the real problem. How do we protect these susceptible animals then if we can't always tell which equid is shedding the virus at any given time?
Since vaccination isn't really an option for the non-equids, strict biosecurity is your primary defense. It has to be. The most critical measure, physical separation. Housing susceptible species like llamas, alpacas, deer, distant from equids, you need to prevent nose-to-nose contact and minimize any chance of aerosol spread. This is absolutely non-negotiable in places like zoos or any facility with mixed species.
Right, distance is key.
Absolutely. Also, any new equids arriving at a facility should be quarantined. A minimum of 21 to 28 days is usually recommended.
That makes a lot of sense. Separate the potentially dangerous animals from the vulnerable ones, almost like creating an invisible biosecure wall.
Yes, that's the goal. And further to that, avoid sharing personnel, equipment, vehicles between equid and non-equid areas if at all possible. If sharing is unavoidable, staff absolutely must work with the most susceptible species first, then move to the equids, and implement strict hygiene protocols in between changing clothes, changing footwear, thorough hand washing. Critical steps.
Okay, work with the vulnerable ones first. Got it.
Plus, infection is also important.
Yeah.
EHV-1 is susceptible to common disinfectants like diluted bleach solutions, so thorough cleaning helps. And finally, just to reiterate on vaccination, current equine EHV-1 vaccines can reduce the severity of respiratory disease and maybe abortion rates in horses, but they do not have a label claim for preventing the neurological form, EHM, and their efficacy, and more importantly, safety, in non-equids like camelids or cervids is unknown, so they're generally not recommended. Biosecurity really is your primary proactive defense shield.
Okay, bringing this all together then. We've seen that EHV-1 is far, far more than just a horse disease. Its silent threat to camelids and cervids, often manifesting as this swift and devastating neurological disease, it really underscores the delicate balance needed in mixed species environments. And I think the profound insight here is the critical role of that asymptomatic equid reservoir, meaning even outwardly healthy horses, donkeys, zebras can pose a deadly risk, which drives home why those stringent biosecurity measures are just absolutely paramount. This is crucial information for anyone involved in animal management, or even if you're just keenly interested in the complex world of animal health.
Yeah, and on a macro level, thinking bigger picture, this deep dive into EHV-1 and camelids and cervids really reminds us of the profound impact of species barriers and host immune responses on how pathogens behave. Kind of begs the question, doesn't it? How many other known viruses, ones we associate strongly with one species, might have these hidden species-hopping lives, waiting to surprise us in unexpected ways? And what implications does that have for global wildlife health and conservation, especially as our environments, human and animal, become more shared and complex?
That is a truly thought-provoking point to end on. We definitely encourage you, the listener, to consider the biosecurity challenges in any animal setting you encounter and the ongoing need for research into these really complex cross-species diseases. Thank you for joining us on this deep dive.